This is Dr. John Staley, President of your home team. Gary, I hope you all are doing well today. We're going to talk about Mental Awareness Month, particularly for May. And we're all going to talk about what leads to mental illness and illness. And so one of the things that I always remember is a couple things. A famous movie called One Flew Over the Cuckoo's Nest, in which Jack Nicholson and a bunch of psychiatric patients under Nurse Ratched are housed in a unit, and you can tell those folks were not normal and shouldn't be walking on the streets. Secondly, there's an old song by Jimmy Buffett, Changing an Attitude and Latitude, and he says if we couldn't laugh, we'd all be a little crazy. If we all were a little crazy, we'd all go insane. But laughter is a key component to preventing mental health that goes astray. Anyway, some of the key factors that lead to Mental Awareness Month, or folks that are tabbed as not being maybe totally normal. A lot of familial or genetic predisposition is probably one of the leading causes of mental health reoccurring in a family. Obviously, people that get on drugs and have more of a propensity to be that way. Certainly stress, alcohol abuse, anything that results in a work environment sometimes, or emotional relationships that go aside, often lead people to depression, and often that leads to other events. And so mental health has several components of anomalies, or we talked about from schizophrenia to depression. Often diseases and dementia can lead to depression. And there are a ton of things that lead to abnormal actions, or what we would consider a little bit outside the normal range of thinking. And so we are blessed to have psychiatrists, psychologists, and one of the key components to having a healthy mind is a healthy body. And so keeping yourself in shape, being healthy, pain, just terrible pain can often lead to drug use, trying to cope with the pain, and that leads to mental stress. And so the main thing you want to do is take time every day to read something that calms you down, whether it's the Bible or whether it's a book. You want to try to take deep breaths, think of positive things, and always remember you're very fortunate to have your mental, physical, and spiritual health. And so praying and doing things of that nature, or whatever makes you feel calm, is also an important part. And so if you feel like the world is changing on you, or you're not coping well with things that have changed, you need to talk to somebody. And that needs to be a physician, a psychologist, a psychiatrist, sometimes a very good family member, or somebody that you, as a friend, that you feel like is very mature, can help you. But one of the things that leads to mental stress is not coping, or either not communicating or letting people know how you're feeling. Now, we all know in the world of social media, that doesn't seem to be as big a problem, but it is, because we're seeing more teenagers, young adults commit suicide, and there's really, you wonder what has triggered all this. Is it the fact that they've seen something on social media? Is it the easy way out? But life's tough. It's tough, and you have to overcome the setbacks, emotional disappointments. We all fail, and coping with failure is how do you cope with failure? Well, you cope with it by being determined. You cope with it by coming back from injury. You got to have a little mental and physical toughness about you, and that's one of the things that this current generation needs a little bit more of. Is everybody's going to experience a setback. The question is, what are you going to do? Muhammad Ali once said, "You've never failed until you quit."